Hi, I'm Jennifer Stewart and I'd like to talk to you about calcium supplementation for horses. There's a couple of really important things to keep in mind. Is firstly that there's not much difference between the absorption and uptake of different forms of calcium. So the supplements are pretty well equal from that point of view as far as how well and how readily available they are. The only time this isn't true is when there are oxalates present in the grass, because the inorganic forms of calcium, which are dicalcium phosphate, monocalcium phosphate, calcium carbonate or DCP and lime, dolomite, they're inorganic forms of calcium, and they, when they're in the stomach, can be bound up to oxalates in the grass. In fact, any oxalate in the pasture free oxalate will bind to that calcium, making it unavailable to the horse. And that's why many manufacturers suggest removing horses from pasture for an hour or two before and after giving the supplement, because they know that the oxalate will bind to the supplement. They also bind to calcium in hard feed and calcium in roughage and other calciums in the horse's diet. So the really important thing is that there's no difference in the absorption with the different forms of calcium, except when oxalates are present. And one of the treatments for oxalate poisoning in species that absorb oxalates, like sheep and cattle and humans, is to give them lots of lime. The reason for that is that the lime will bind to the oxalate and prevent it being absorbed into the blood, where it causes oxalate poisoning. So we know that lime and other sources of calcium like milk are used to treat oxalate poisoning in other species, and they do that by binding the oxalate in the gut so it's not absorbed. The only form of calcium that is readily available and absorbed in the presence of oxalates is chelated calcium. Now, the calcium oxalate in the plant is a form of chelate. Chelated calcium that we use in supplements that are specially formulated and tested and trialled for use in the presence of oxalates are also a chelate, but they're chelated to an amino acid, so their absorption is complete and they're not going to be attacked or inhibited by the presence of oxalates. As the oxalate level in the pasture increases, you must increase the amount of inorganic calcium, and that in pastures when they're high in oxalates, which can be after they're fertilised, whether with chicken manure or whether the pastures are fertilised with lime or superphosphate, the oxalate content in the grass will increase, and therefore you must increase the amount of inorganic calcium you provide. And sometimes on the paper the figures can show that horses might need 300 to 500 grams. That's half a kilo of lime a day. If the calcium's chelated, then the amount stays the same regardless of the oxalate level in the pasture. The other advantage of chelated calcium is that many people are aware that it's not just the calcium-phosphorus ratio that must be kept in a certain range. It's also calcium to magnesium ratios, zinc to magnesium, and a lot of the minerals do compete and interact with each other when they're all together in the soup of the gut. And so we must try and keep those mineral ratios correct. If we're using an inorganic calcium to address the problems with calcium deficient diets because of oxalates, then the more calcium you give, inorganic forms will bind with other minerals. Chelated calcium won't, so you don't need to worry about the mineral ratios and upsetting them, and you don't need to give them large amounts of lime or DCP. So they're the benefits of chelated calcium. So let's just have another close look at what chelated calcium is. Chelation is from the Latin, like most veterinary and medical words, and it means claw. And so when calcium is in a chelated form, it's within the claw of an amino acid or a protein. There are different forms of chelation, but basically it's a very strong bond that's like a claw around the calcium. Now, there are many types of chelated calciums. There's some chemical forms like calcium EDTA, which is what we put in blood tubes to stop blood clotting when your vet takes the blood. There's also protein chelates, and there are amino acid chelates, and even within amino acid chelates there are different amino acids that are used for chelation, and that will affect whether it's 12 or 15 or 20%, however much calcium is in the chelate will be determined by which amino acid or protein that it's chelated to.